All right, Bill, November, National Juvenile Diabetes Month. Here to talk with us about that, Dr. Andres Afanador, a physician with New Hanover Regional Medical Center's Physicians Group, speaking specifically about juvenile diabetes. How common is this with children these days?
That's right. So the reason I'm here is this is Juvenile Diabetes Awareness Month. And so juvenile diabetes is actually not as common as type 2 diabetes. According to the CDC, about 1.25 million Americans have juvenile diabetes or type 1 diabetes, whereas about 26 million Americans have type 2 diabetes.
And type 2, adult onset?
That's right.
Okay. And when you see children with this, are you born with juvenile diabetes? Is it something that comes on as you age?
Right, so that's a great question. You're typically not born with juvenile diabetes. It comes on with adolescence or with early childhood. That's why it's called juvenile diabetes, also known as type 1 diabetes.
And as far as treatment, I know, I have a person, my father is diabetic, so I see what he goes through. Treatments similar with juvenile as well as type 1 to type 2, I should say?
There is some overlap. So juvenile diabetes typically requires treatment with insulin.
Okay.
So the reason juvenile diabetes exists is because people don't produce the insulin that they need to control blood sugar. Whereas in type 2 diabetics, they can use insulin as well as oral medications, things like metformin and glyburide.
And I know with my father, one of the first things right away he was told, you can really help this with diet.
That's right.
Does that play true with kids as well? And I find it interesting you said the insulin, because one of my kids were asking me yesterday saying that we know someone in school that has diabetes.
That's right.
And I had said that they're probably taking a pill, unlike Grandpa, who uses an injection, and I guess I'm wrong with that.
So typically, correct, they do have to use injections of insulin. That can be either shots or an insulin pump, something that actually attached to the body that constantly measures their blood glucose levels and gives them constant infusions of insulin.
And again, could we monitor this a little bit better with a special diet for children?
Sure. So diet regulation is always extremely important, particularly carbohydrates. So those are the things that are broken down into sugars inside the body. So people with type 1 diabetes really closely have to monitor what they're eating and what amounts of carbohydrates they're taking in.
And last thing I'll ask you is, if there's a parent at home, what do they look for in their kids before they come see you?
That's a great question. So type 1 diabetes presents really non-specifically. So kind of symptoms that they might have are fatigue, increased thirst, a lot of frequent urination, and fatigue and vision loss. This is actually another thing that can present. So a lot of non-specific findings they can present, but you have to be sort of on the lookout for them.
And again, I always end this thing by saying, if you have questions, if you think there's a problem, don't call the TV station. You always want to call your physician to ask questions.
That's
there.
Right.
He went to a lot of schooling for a reason.
I did.
Doctor, I appreciate it.
Thank you.
Thank you. We're back with more after this.